welcome to the latest edition of CRDA's Resources for Resiliency. Very happy to be joined today by a friend of CRDA, former board chair and currently senator in the South Carolina Senate for District 38, our friend Sean Bennett joining us today. Sean, how are you?
I'm good, Brent. Thanks. Appreciate you having me today.
So, obviously it's a strange time. We've now been at this since about the middle of March, and even though things have opened back up, we're still dealing with it. But I guess from the legislature's perspective, how did COVID-19 impact y'all's ability to work this year?
It affected us just like everybody else in the sense that it shut us down. We have not been in session. Normally we are in session from that second week in January through the end of May, and once we hit early March, we were shut out of there, just like a lot of businesses. So a lot of stuff has gone undone. Probably the biggest impact that's had on the state is we were not able to do a budget. South Carolina does an annual budget. I wish we didn't do an annual budget, but we do an annual budget, and completely just impossible to do that because we just don't know what the revenue is going to look like. Sales taxes are down, income taxes are down or delayed, hospitality taxes are down, all revenue generation sources from the state. We just don't know what they are. So that's been the biggest challenge for us, is not only have we not been able to do the normal day-to-day things that citizens of South Carolina require us to do, changing statute, eliminating statute, adjusting statutes, but fiscally we have not been able to prepare a budget. We're operating off of a continuing resolution until hopefully September or October. I think we'll probably be able to get back up there. We did pass some legislation that will allow us to work into the fall, where normally we were not allowed to do that. We believe by end of September, early October, we'll be able to get good revenue figures and get back up there and get a budget done. And then hopefully that puts us on the pathway of being back to normal in January when we go back in session.
So you will be working, I guess, through the summer. I think some folks maybe were unsure about whether you would be back. So you're still anticipating September, October-ish for an actual budget. So that's good information.
I do. We have to. We have to do it. We can't. I don't think anybody wants to operate under a continuing resolution the entire fiscal year. There are too many different needs that we have that we've got to address. And again, it's really just a matter of once we can be confident with the revenue projections from our economists, then we'll be able to get in there and do the budget.
I want to switch gears a little bit about, how would you judge, I guess, the state's reaction overall and our response to the COVID-19 crisis?
I guess you have to look at this from a couple of different lenses. The first lens that you've got to look at it from is that this is completely unprecedented, right? We've just never done this before. This state is used to dealing with crises, whether it's hurricanes or those sorts of things that we have to deal with on an annual basis. We're pretty good at that. We're prepared for it. Not only the government, but the citizenry as well. This was came completely out of left field. Didn't come out of left field. We knew it was coming, but the way that we had to handle it was completely different than others. So from that lens and the fact that we've never had to do it before, I think that we've had a pretty robust response. I think we've done a pretty decent job. There's a lot of areas that I didn't like from government involvement. From the federal level and the state level, some of the things that probably added to the economic hardship that we've gone through, recognizing it's a difficult balancing act. How do we do some economic relief packages to help people get through, but at the same time, not create a very steep uphill climb for us to climb out of. So that's been a challenge. The healthcare response to it, though, I think has been pretty good. South Carolina I think Governor McMaster did a pretty decent job in dealing with that and not completely locking us down very early. Trying to keep the economy going as much as possible, finding that balance. That's always the challenge, right? As I watch some of the other states deal with this thing, we certainly want our people to be safe. But what you have is you can't let the healthcare community make every decision on how to react. And we can't let the business and economic community make every decision. There's got to be this balance to get us through. And I think we've done as well as we can to balance that effectively. And
it's interesting you mentioned the healthcare community and kind of the false choice that was set up between you got to do one or the other. It's an and situation. We have to do both. Our case count is creeping up, as you know, headed sort of in the wrong direction. We've been involved, obviously, in our region with the One Region Ready program that we've spun up, and really in conjunction with MUSC, just over the past week, we've started sort of doubling down on the messaging regarding masks and social distancing, hygiene, and all, and the large crowd kind of conversation. Do you see a understanding that the governor has stopped short of mandating? Do you see a situation where 5 or 6 weeks from now, if things don't improve, the legislature could step in and say, hey, we may need to pump the brakes on things a little bit?
I really don't, Brent. I don't see us. Of course, you never say never. We started this conversation with saying this is a completely unprecedented issue that we're all having to work through. So I never say never. However, given that and the knowledge that we are gaining every day, certainly the uptick in cases is not a good thing. It's not something that we necessarily like to see. At the same time, the flip side of that, I've been talking with healthcare professionals in our own community at the hospitals and local physicians and the like. And the good news about this is that while, yes, the uptick is there, what our healthcare providers are seeing is that the people that are coming to them, whether it's in hospital or the doctor's offices, are dealing with it much better. The recoveries are much better. And it's not as a difficult of a road to hoe. And I think we like to get caught up in numbers. And as you know, we can make numbers say whatever we really want them to say. But while the numbers are going up, the real challenge and the concern that we had nationwide going into this thing was we didn't want the numbers to get to a point where they would overwhelm our healthcare service. And that never happened. That never happened here in South Carolina. We always had some smooth, some buffer there. So we were never overwhelming our hospitals, our medical facilities. That still remains the case. I don't think anybody ever said that there wouldn't be a number of people that wouldn't contract this issue or this disease or this virus. What we want to do is make sure that we're able to care for them and get them healthy again. And I think that's what we're seeing. So unless things get really bad, unless we start seeing the taxing of the healthcare systems, I don't see an instance where we'll come back and lock things down to the extent that they were locked down before. I don't think that's good for people. A strong economy, you can make the argument that a strong economy is going to do as much to prevent healthcare issues and deaths of people than a virus will. We need to be able to eliminate poverty and keep people working and have people that have something to look forward to and be able to afford healthcare and all those different things. And that comes with a strong economy. So I hope we don't have to get to the point again where we're pulling that economy back and causing more hardship.
A couple more quick questions on the COVID situation. First off, Senate Finance approved the CARES Act money, how to spend the $1.2 billion or so that we have in front of us. Could you share what are the high points, and then once you guys make a decision, how quickly do those dollars sort of flow?
We've got about $1.9 billion from the federal government that came to South Carolina that the General Assembly will decide where that money goes. We voted in the Senate to deal with $1.2 billion of that right now immediately. One, because it's a very fluid situation, and we just don't know what we're facing as we move through it. So we felt it prudent to hold back about $650 million of that for another round of this allocation, probably again in that September, October timeframe when we come back for the budget. Of the $1.2 billion that we spent, though, the real important parts are broadband expansion. We have committed to, and with the dollars from the federal government, we have a really great opportunity to put in place expansion of broadband capabilities to the entire state of South Carolina. And that is a commitment from everybody on Senate Finance. I have not heard of anybody in the Senate that's opposed to that. That will do a number of things. One, it will improve education opportunities. You know, if we have another instance where we have to have a lockdown and students can't go to school, we'll have online capabilities to reach every student in South Carolina. But it will also provide us to the opportunity to create some real opportunities in healthcare and business continuity and expansion of business in some of the more rural communities that have to have that type of technology that weren't able to get it otherwise. So that's kind of one of those bullets that does three things for us right out of the gate that helps education, helps healthcare, and helps the business community. So that's a big deal. We've allocated about $50 million of that initially, with probably plans to do another $30 to $100 million to get that implemented pretty quickly. Some other highlights is about $220 million for education. A lot of that is we lost touch with a lot of students, a lot of these in the rural communities, when we went to home-based and online learning for the last couple months of the school year this year. Just lost contact. So we put in I think it was about $50 million or so to do some summer camps for those students to get them back in the schools. There's some very intensive English and math training. That's a big deal. Some more money to bring the students back early for the next school year to get caught up. That's an important piece. Another $270 million to local governments, municipalities, and county governments. Those are probably the biggest pieces. And then the large piece is $500 million that we've committed to the Unemployment Insurance Trust Fund. We have blown through that. We did a remarkable job. Really, the business community did a remarkable job over the last 8 to 10 years of rebuilding our unemployment trust fund from the Great Recession, got it up to about $1.2 billion, and we have basically wiped that out, or will wipe that out by mid-August. So putting a lot of this money back into the system and not on the backs of business is critical to help those folks recover as well.
Yeah, you definitely don't want to be in a position where you have to borrow money to fund unemployment. So that's very important. Great to hear the news about broadband as well. And I have two sisters that teach in rural areas, and your point about losing touch definitely rings true, because they were sharing some stories with me a couple of weeks ago. So I guess last thing on COVID, liability obviously is a huge concern as we sort of reopen the economy, and businesses are quite frankly a little unsure of what they can and can't do, and what risks they are taking. I know the Senate's working on some legislation right now to protect employers. So what can we expect from that legislation? How can it protect employers, and also how can it protect employees if the employers don't take the proper safety precautions?
Brent, I don't know the answer to that. I don't know how we'll get there. I know that there is a lot of talk. There are a lot of discussions going on There's a need for that. Most states around the country have passed or are in the process of figuring out some sort of at least limited tort liability protections as they relate to COVID. We have some obstacles here in South Carolina. Is one of them is the limited time that the General Assembly has available, and the fact that we've got to be able to do something quickly means that we need to get some sort of bipartisan agreement from all the stakeholders to move something forward. That's a big challenge. As you know, tort reform is always a big topic. And both groups on both sides dig their heels in very quickly on those sorts of issues. But I think there's agreement that this, again, is an unprecedented case. It's very hard to determine, where somebody contracts this virus, right? And is it contracted in the workplace, or is it contracted elsewhere and brought to the workplace, and those sorts of things. So it's a complex and complicated problem. I can tell you that we're working on it. I can't tell you that I have a crystal ball that says we'll be able to pull a rabbit out of the hat and get something done. I'm hopeful for that. But we need to protect businesses so that they can open. And we need to also, and I haven't met a business yet that doesn't want a safe workplace for their employees. And employees need to know that. They need to have some comfort level. And I think there's some balance there of saying, if the business will do A, B, C, and D, and to ensure to the best they can the protections of an employee, that they're going to get some protections in return from the very expensive and time-consuming litigation that can come from that. And I'm hopeful that we'll get there.